graveyard is huge, and there's no sign of the crew or the patient.
Not in there, are they?
You should see the cyclist just coming down there.
Okay.
Ambulance service, is the patient breathing?
Yes.
Are they awake? Are they conscious?
I don't know. It's my husband. He's just said he needs help. I don't know.
Are they awake? Are they conscious?
Yeah, he was. I've lost him now.
What's the reason for the call?
He's fell through a floor. He's on an old farm and he's on his own.
Okay, what's the address of the emergency?
All I've got is like a derelict farm.
What's his name?
Neil.
And how old's Neil?
63.
Leave it with me and I will try and ring him and I'll find out where he is. We've got the help arranged.
With reports of a serious accident in a remote rural location, Helimed 03 is scrambled.
A 3-year-old male, he's had a fall from height to approximately 12 feet. Injury to the head and the back appears to be quite a lot. Is that received?
Yes, that's affirmative.
The patient could have wide-ranging injuries, anything from a serious head wound to spinal or internal damage. All common conditions associated with even a shortfall from height.
So we're looking for a farm. Fairly isolated farm, isn't it? Yeah.
Fortunately, the site is less than 2 minutes' flight from base.
So I would say this one, according to the map. What do you think? Okay, blue container, somebody in the field. Yeah.
A man spotted propped up against a metal container confirms the team's in the right place.
We'll go to the brown field to start with. Yeah, hop over the hedge. Everybody happy with that? I'm happy with that. It's going to be quite dusty.
An adjacent field provides the perfect landing spot.
Just watch your feet when you go out. There's a lot of ruts. Okay.
Within moments of landing, Alistair and Ali reach the patient, who is with a passerby.
Hi, folks.
All right, guys. Came across you.
All right.
I was walking the dog.
Hi, Neil.
That's okay.
Okay.
53-year-old Joyner Neal was carrying out a survey on the first floor of a derelict building when rotten floorboards gave way, and he fell 12 feet onto concrete.
You got any medical problems, Neil? No. On any medications? Asthma. Okay, good lad. Where's it hurting you the most, buddy? Okay. So you managed to walk up to this place? All right.
Neil was just able to get himself out of the building before collapsing. He has a cut to the back of his head and pain across his upper body.
Right, okay. Big breath in for me. Where's that hurting? This side on the chest?
Yeah.
Okay. In the middle? In the middle? Any pain in the belly? Good lad. Any pain in the hip area? Legs feel all right?
Yeah.
I'm gonna have a look at your back, all right?
Dr. Ali wants to pinpoint exactly where Neil's injuries are.
I might have to cut some of your clothing. I appreciate you're a little bit chilly, chap, but I just need to have a look at what's going on with arms and so on. So.
Right, do you think you could sit forward for us a second? Right, but I'm just gonna feel my way down. Pain here? Pain here?
It's too lumps.
Yeah, it's got a lump on the left side, thinking posterior rib.
The worst pain is in the left side of Neil's chest. A visible indentation on his back points to a broken rib, which could have punctured a lung or be causing internal bleeding.
So if you take a big breath for me, is that stopping you? Difficult to breathe in? Okay, well, so possible chest pathology.
He needs urgent hospital treatment.
I'm going to stick a little needle in you, chap, and we'll see if we can sort some pain relief out for you.
Alistair is preparing to insert a cannula in his arm so analgesic drugs can be given intravenously and provide the pain relief Neil badly needs.
Are you using all of this arm to support you? Is there any chance I can take the weight off that arm? Just look at popping a little needle in you. You need to put the arm down, tell me. And you're working here on your own? Yeah.
Hey, buddy, just whilst we're trying to get a line in, yeah? Just have a quick look at your chest, all right? Might be a bit sore, just bear with me.
Sharp scratching your hand, chap, sorry.
Dr. Ali uses an ultrasound monitor to look for signs of a collapsed lung or pneumothorax, a life-threatening condition that can be caused by a broken rib puncturing the lung wall.
Take a big breath in for me, buddy. That's fine, well done.
The ultrasound finds no evidence Neil's lung is currently compromised, but it could still happen at any moment.
Hi, guys, you all right?
Ali updates an ambulance crew who've just arrived.
So we've fallen from the first floor inside. He's basically gone and landed what looks like on the left back and head. Not knocked unconscious. He's managed to come and find his way out here. The main pain he's complaining about is left chest, shoulder and back. And looking at it, you can see it looks like some sort of indentation. He says he feels a bit sort of like tight in breathing, but we've done a quick ultrasound, can't see any pneumothorax, so I think it just looks like ribs and maybe back for now. He has got a head injury.
The nearest major trauma centre is 20 miles away. And with Neil's injuries, it's quicker to fly the patient than transport him by road.
Oh, please, yeah.
It's penetrated a little bit. It's like the heel at the back.
While the ambulance crew dress Neil's head wound,
That's going to sting it just slightly, okay? We're just going to cover it up.
So 3, quick update for this gent then is
Alistair calls the trauma desk to let them know the plan.
he has fallen probably 12 feet unwitnessed, got a deformity to left rear of back, plus and minus a shoulder injury and a laceration on the head. With a chest wall deformity, we're thinking up to Stoke, and we'll probably fly him over.
Roger, that's received. Thanks for taking that.
No worries, it's going to take us a few minutes to get pain relief sorted before we can move across into heli and so on. So as soon as we're sort of loading in heli, we'll give you a proper shout over.
All right, buddy, painkiller's coming up.
Dr. Ali administers morphine to get Neil's pain under control before they attempt to move him.
All right, here, Neil, just going to give you some of the good stuff. How are you feeling now? A bit woozy? In your legs? All right, buddy. Don't worry about that. I can't give you any more now because you're sat up. I don't want you to fall over. Just as soon as we get you lifted. Feeling any better? Yeah, good.
Neil is now ready to be taken to the helicopter.
There's going to be an issue of lying flat on here with the back pain.
Yeah.
It's not going to be straightforward.
He's been like this the whole time.
Okay.
I'm just thinking. Let's have a feel of the back now. Just going to have a press of the back, Neil. I don't think we're going to be able to lie down flat.
Okay.
It's going to be the issue.
Lying Neil flat on a stretcher is likely to cause him too much pain.
Because I mean, I've given a decent amount of analgesia, but we're very, very tender.
Okay.
How are we going to get him across from the trolley?
A trolley bed would be more comfortable, but couldn't be wheeled through the ploughed field.
We're going to have to carry, probably.
Or carry chair?
We could do a carry chair sitting,
Yeah.
but then moving him or flying him, sitting up is going to be awkward.
Yeah.
Only other thought is we walk to the helicopter.
No. Shall we try that, Neil? Walk you to the heli?
Getting patients with traumatic head injuries up onto their feet is usually avoided. But in certain circumstances, it's the best option.
All right, Neil, let's just stand you up and see what you like on your feet. Because if we are going to walk you, we can walk you to the scoop. All right, Neil. Now, I know this arm's a sore one, but I'll just give you a little bit of support by grabbing your trousers. Let's go, nice and slow. Good lad. That's the one. Gotcha. Giving you some medicine that's going to make your blood pressure drop a bit. Just take it nice and steady. Let's just get you laying down here then, because that's the way we're going to transport you. Neil?
Things we used to do and don't.
We're going to lie you down onto the scoop and then take you back nice and slow, all right?
No.
We've got you, I promise.
No, I'm going to fall.
No, you won't.
Oh, yeah, that's it. Relax back. Yeah,
All right, there you go. Good lad.
Once on the scoop, Dr. Ali can give him more pain relief.
Yeah, because there's some more painkillers coming in. Well done, buddy. How you doing, Neil? That better now? Good lad.
Among Neil's injuries is a suspected broken rib, which could puncture his lung at any moment.
Do you want to hold that? Sorry. Fiddle out, maybe.
Neil, you okay, buddy? Just open your eyes for us. Good lad. That's fine. Well done.
Now prepped for the journey, Neil can be safely transferred into the helicopter.
So one either end, and we're heading for this side of the helicopter, but at the back, where we will then, we need the feet towards the tail, and he'll go in head first.
Okay.
Okay, right. Ready, steady, lift.
Bystanders have helpfully dismantled part of the fence to make life easier. But there's still a ploughed field to negotiate.
You okay, Neil? Good lad. Just 2 minutes of this, all right? Coming up to the big rut. Just going over the rut.
Okay. Just nice and steady. Okay. Does anybody need to reposition? Are we happy? Okay. So we're in the rut, hopefully, or on top of it.
Neil is positioned head first into the aircraft, so Dr. Ali can provide critical care en route.
Just again, everybody happy? There's going to be a bit of a lift now.
1, 2, 3.
It's another half a foot. 1, 2, 3, and stop. Perfect.
Lovely.
03 receiving.
Before setting off, Dr. Ali gives the trauma desk another update on Neil's condition.
So we've got a male fallen approximately from first story, landing on left rear chest. Injuries-wise, he's got a head injury to left occiput, possible chest injuries with maybe a underlying pneumothorax.
All receive, thank you.
Thanks very much. Any changes, we'll give you a bell from the air. You okay, Neil? Give us a thumbs up now. That's the one, good lad. I know what to look out for now. Very loud and very shaky, okay? All right, Neil, there's going to be a start-up.
Neil's destination is the Royal Stoke University Hospital. By road, the journey would have taken 40 minutes. By air, it's just 15. Here, Neil is handed over to the emergency department for urgent scans to discover the full extent of his injuries. As a major trauma centre, all specialists are on hand for any treatment he may need.
Ambulance service, is the patient breathing?
I don't know, just reduced an accident.
What type of, is it a road traffic accident?
Yeah.
I'm sorry, what's actually happened?
I don't know, I was right in the back and I just heard a crash.
Ambulance service, is the patient breathing?
I'm not sure, we just heard the bump and we've gone running down and there's somebody on the floor.
Okay, is the patient breathing and awake?
I don't know, they've just sent me to run back.
Okay, so is it cars?
No, it's cars and pedestrians.
Initial reports that we got on this are there are 2 pedestrian patients, peri-arrest.
It's Saturday afternoon, and critical care paramedics Alistair McNeil and Richard Apps are on shift.
Okay.
Their specialist knowledge and equipment is the reason why they get sent to some of the most serious medical emergencies across the West Midlands.
So we're heading to an RTC in Wolverhampton area, reported as 2 pedestrians that are peri-arrest, and we're probably about 10 to 15 minutes out.
Peri-arrest is when a patient's body is in a highly unstable condition and they're in danger of going into a cardiac arrest at any moment. Multiple emergency services are on their way.
The latest update on the radio is that we have 2 helimed en route, both with doctors, so the potential injuries are significant. Whiskey Romeo 7062. Is there any information on patients' conditions at all?
Patient number 1 is a female, early 20s, potential head injury, quite agitated, and an injury to her right arm. And then patient number 2, male in his 20s, same head injury with agitation. He's got lacerations to his chest and back, and he's got a partial amputation of his right wrist.
Whiskey Romeo 7062, we're approximately 1 minute from scene.
Thank you.
The accident's taken place on a residential street. When Rich and Alistair arrive, 3 ambulances are already there, as well as the first of the air ambulance crews.
You have that lady there,
Right.
and then we'll put this one with the aircraft crew.
While the helimed team focus on the male patient who's already in an ambulance, Rich and Alistair turn their attention to the female.
Hi all.
Oh, electric scooter.
Both occupants of the scooter.
Right.
19-year-old Shante had been riding with her boyfriend on an e-scooter when they collided with a car. Neither were wearing helmets. Shante struck her head in the impact and has also sustained injuries to her legs and arm.
What have we got so far?
No obvious C-spine, spinal pain, injury. Says she can't feel her legs, but she's moving. Blood pressure did drop a minute ago, but that's stabilised at the moment. Keeps going between agitated, unresponsive. At the moment, she's calm, she can hear us.
Yeah. GCS? Rough or AVPU?
It's kind of 15.
She's talking to you?
Yeah.
Although she's now conscious, Shantae's condition is critical.
And blood is coming from, do we know?
Mouth, we've got a wound to the mouth, wound to the ear, big wound to the left arm, quite a nasty wound to this elbow, possibly down to the bone, as best we could see.
Okay. Finish flushing your cannula. Let's get her on the stretcher on the back of the truck, and then we'll have more space.
Shante had been riding with her boyfriend on an e-scooter when they collided with a car. Neither were wearing protective clothing.
So at the moment we've got 2 patients with critical injuries, unfortunately, and significant damage from head-on into a car by the looks of it, which is a shame. Electric scooters as well, unfortunately, so no helmets that anybody's wearing.
While a helimed team leads the treatment of her boyfriend, Rich and Alistair are focusing on Shante.
Can we get the oxygen back on, or was she not?
She threw it off a minute ago,
Let's just put this oxygen mask on you.
She has injuries to her legs and mouth and a deep cut on her elbow.
You happy there's enough of us to lift without straps?
Got one on.
Got one on, that'll do us, won't it?
Rich and Alistair want to get her into the ambulance as quickly as possible.
Okay, don't worry too much about her head. If she's, just tell her to keep it still for now.
Happy that we've got enough hold. Up.
Just get rid of the... Fine. Okay.
We're going to get you onto the ambulance.
Get her to keep her head still.
As a result of her head injury, Shante is confused and tells the paramedics her name is Charlene.
Charlene, can you just ask her to squeeze my hands, mate?
Will you just squeeze the gentleman's hands for us, Charlene?
Yeah, so obeying commands.
Charlene, sorry for me. That's better. Keep talking to me, sweetheart, yeah?
Shantae's conscious, but in a lot of pain.
Really important. I know it hurts.
While Shantae's cuts and lacerations are clear to see, it's the possibility of internal injuries that's giving Rich and Alistair cause for concern.
Charlene, what's hurting?
The second doctor-led helimed team has arrived to help.
Have we had any treatment? Checks, nothing?
Nothing yet,
Doesn't take so yet.
Literally, we haven't got IV yet.
Got a vein this side. Charlene, keep your arm still for me.
Where were your tourniquets?
I will need a tourniquet, but just press the BP cuff.
Alistair inserts a cannula into Shantae's arm, so the doctor will be able to give drugs intravenously.
I'm going to need a bit of gauze here. Sorry, mate. 10 mil flush, very nicely. Lovely.
You did a BM?
Don't think anybody will have done a BM yet.
The BM kit measures a patient's blood sugar levels. It's used to help build a picture of their overall condition.
Sorry. Where are we?
BP is on cycle, guys.
OK, we've got 9.4 as a blood sugar, people. And a BP is 97/48.
She's quite a slight lady, isn't she?
Yeah. Cannula that I've just flushed for you.
Right, fluids are ready to run.
With Shante now prepped for the journey to hospital, Rich and Alistair hand over to the helimed team.
Anything else you want, guys, before we dismiss?
Or do you just want to do stuff on the way?
We'll start rolling.
As the helicopter had to land some distance away, it's decided the quickest option is by road.
Thanks very much.
OK, see you guys.
Ambulance service, is the patient breathing?
Yes. Is the patient conscious and awake?
Yes.
And what's the reason for the call, please?
Broken leg.
What's the address of the emergency?
We're in the graveyard in rollercoaster.
And you're actually in the cemetery?
Yeah. Below the willow tree. She's feeling quite faint. Yeah, she's literally about to pass out. She's passing out right now.
Okay, is she unconscious now?
Yeah.
Is she extremely pale? Any blue or grey tinges around the mouth?
Yes. It's very white, yeah, definitely very white.
We've got an ambulance coming out to you on blues and twos now, and I'm going to stop on the phone with you until they arrive.
A woman has lost consciousness after falling from a tree and hurting her leg. An ambulance crew is already on its way, but because advanced medical skills may be needed, the critical care team have been dispatched.
We're going to a 26-year-old female patient who has apparently fallen and is possibly unconscious and not responding.
Any fall from height can result in life-changing injuries. The fact that this patient has lost consciousness is a major cause for concern and could indicate a traumatic head injury.
Oh, there's the crew. I reckon we can park it here. Okay. Have a wander.
At the cemetery, the ambulance is easy enough to find.
Give us a clue.
But the graveyard is huge, and there's no sign of the crew or the patient.
Not in there, are they?
As she could be in danger, Jack and Sam must locate her fast.
Ah, visual. Has she jumped up here?
No.
We'll come down.
The 26-year-old woman was trying to climb a tree after a night out when she fell, badly hurting her ankle. Her friend was with her and dialed 999.
Hi there.
Oh, you're all right.
Hi.
She's probably up about here.
Yeah. So not fallen too far.
No.
The woman's now regained consciousness. The ambulance crew have checked her over and don't think she has a head injury. It appears she fainted from the shock and pain.
Fallen awkwardly, and she just says left leg just sort of come this way.
Hi, underneath. Fine. Okay. Hi, my name's Jack. I'm one of the critical care paramedics from Midlands Air Ambulance. Do you have any pain up here? No. No. I'm not even going to touch this till we can get your shoe off. And where's most of the pain? Obviously around here, yeah? And have you been able to put any weight through it at all since? Absolutely. Okay, so I think that's fairly obvious, isn't it? You've broken that.
Yeah, I saw it bent that way.
Can you wiggle your toes?
No.
Jack confirms the woman has broken her ankle.
So what we need to do, if we can get chair, blankets, large splints, we'll get some access, we'll give some pain relief.
The injury will need to be treated in hospital.
So the plan is we're going to obviously get you out of here. It's pretty cold, pretty miserable place to be sat with a broken foot. In the meantime, just some general obs. If you're OK with us putting a little needle in the back of your hand so we can give you some strong pain relief. We'll get this shoe off to have a proper look at your foot.
Before they move the patient, Jack and Sam want to take a closer look at the injury.
Can I have a little look at this arm? Pop this around your arm.
Sam prepares to cannulate so that pain relief can be given intravenously.
We've got her heart rate, we've got everything else. Are you allergic to any medications? No? OK.
Jack checks it's safe to do so.
Any alcohol or drugs or anything overnight? Yes. Both or just alcohol? Fine.
Sharp scratch in your arm, all right?
Nice and still.
We'll get you some pain relief now, all right?
With the cannula in, Jack administers a dose of morphine.
It's a very strong painkiller. It can, sometimes when it goes in, it can feel a bit itchy or hot as it comes up your arm. If it starts to make you feel sick or horrible, we can reverse it, or we can give you something for the sickness, OK? But at the moment, it's just most important that we get your pain sorted, OK? That's 4 milligrams now. At some point, we are going to have to start thinking about how we're going to move you and get that shoe off, and it is going to be uncomfortable, but we are going to dose you as we go.
Even with morphine, removing the woman's shoe will be extremely painful.
Can we set the gas and air up as well?
Yeah, and the IV paracetamol can go up as well. It'll go in over the top of the morphine. And then what we're going to do is I'm going to hold your leg nice and still, and Sam's going to gently bring your shoe off and your sock. How are you feeling with that morphine? Any change?
I mean, I can't really...
Sorry, yeah, you have, I think, ankle and tib fib, because that is very floppy.
Yeah.
Feel me touching here?
Yeah. Yeah.
The young woman has suffered multiple broken bones.
It looks like it's a fairly straightforward fracture, though. You've got a fracture, well, maybe three. Fracture of the ankle, and then a fracture of your tib and your fib.
Sam and Jack must now protect her leg with a vacuum splint.
Sorry, sweetheart, I just want to give that stability, but well done. It is cold, yeah. A bit more, yeah. Happy? It's more stable than it was. That is well splinted now, so that your leg won't move in the way that was painful before. We're going to give you some more morphine, because we're going to start moving you now.
With her leg now stabilised, the patient can be moved to the ambulance.
Well, I come under your arm, you hold on to my arm. Okay. Bend that good leg. And ready to push? Okay. On your call, then. Just hop.
Am I hopping it? Am I hopping it?
Yeah. Keep coming back. And can you push yourself back a little bit more? In fact, before you do that, let me get this blanket around you. So, arms in, just careful of that cannula.
Oh.
Are you okay?
The young woman is strapped into a carry chair. Yeah. It's a team effort to lift her up and out of the cemetery.
3,
Step.
2,
Together. Step.
1.
Together. Step.
Flat.
Together.
Once in the ambulance, Jack and Sam can hand over to the crew, who will take her to Sandwell Hospital for x-rays and treatment of her broken bones.
Considering the injuries that she's got, she was in pretty good spirits. And I think the alcohol she had on board probably helped. She works in a bar, and obviously they've had a good night. They've come into the graveyard and they thought they'd climb a tree, and I think sadly the choice of footwear probably hasn't helped her. She's fallen out of the tree. Decent pain relief makes a big difference in these types of injuries. They are very painful. She's got multiple breaks, multiple bone ends pushing against each other.
Ambulance services, the patient breathing?
Yes, he's breathing. He's fell off some scaffolding.
Okay, how old is the patient?
He's 74. He's gone very pale.
Okay. The emergency ambulance has been arranged.
Back injuries are among the most common major traumas and can be life-changing. It's estimated that every 4 hours someone in the UK is paralysed from damage to their spine. With a chance he could be seriously injured, critical care paramedics Steve and Mitch Mitchell and clinical team mentor Ben Reen are dispatched.
We are going to a 74-year-old who has fallen off some scaffolding boards, approximately 12 foot height, and apparently landed flat on his back. He's complaining of back pain and arm pain. So the risk is that he's got a spinal injury, really. His age brings something into that as well. Any pre-existing medical conditions like osteoporosis, brittle bones, they make a big difference.
Ben and Mitch are first on scene and find the man in his front garden.
Hi there.
What's your name, sir?
Paul.
Paul. I'm Steve and this is Ben. How old are you, if you don't mind me asking?
74.
74.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
You look like you're in a bit of pain there.
Yeah. I've got a nasty gash on my finger.
Yeah. And where's the majority of your pain?
Across my back and in the hip.
And with regards to the pain in your hip, is it on the same side as your back? Or is it the other
left side?
Left hip, OK. We'll just go have a quick look at your back and left, OK.
Whilst we're doing that, can you tell us what happened?
Yeah. I was on the platform up there.
Stood up?
Yeah. Stabilisers were all out. And for some unknown reason, it just started to go that way.
Yeah.
Twisted around, and I fell onto that bar on the dock.
Were you knocked out at all?
No, luckily.
Good.
Yeah.
Saves that.
Bloody hell. No,
All right, pop your blood pressure cuff on there.
Where possible, the advice after a fall like Paul's is to stay still, because moving can cause injuries to worsen.
The reason I got up was because they were worried these plants might fall off on me.
OK, gotcha.
Fearful of the scaffold boards falling, Paul's wife and some nearby workmen moved him to safety.
When they assisted you up, did you move anything by his own means, or...?
Not a lot, no.
No, OK.
Mitch and Ben decide to leave him sitting.
You're fine as you are. We'll work around you.
Okay.
All right.
Are you short of breath at all?
No, it's painful to breathe in.
Just painful, okay. You might have done something with your ribs at the back. Can you try and push down on your leg as if you're going to get up, but I don't want you to get up like that, okay. Right, we'll get you a little bit of oxygen and I'll just go and get some painkillers out of the car, okay?
Thank you.
All right.
The pain in Paul's chest points to a fractured rib.
Pop this on.
Is he normally quite a pale complexion?
Yeah, he's pale, but he's got
Yeah.
more pale than normal.
Mitch calls the control room to request an ambulance.
Could do with an ambulance. Patient's got shortness of breath from pain along ribs.
A spinal injury also can't be ruled out.
Would you like that as a red or an amber backup, over?
I'd probably put it as a red. What were you trying to do then?
All the wood's rotten. I was going to replace that.
Yeah.
And then paint the house.
Paul is in a lot of pain. He needs a scan to determine whether he has broken any ribs and to make sure he hasn't damaged his spine.
Did you want to do cannula and stuff like that? Yeah, it's sound.
While they wait for an ambulance, Ben and Mitch are doing everything they can to make him more comfortable.
This arm's not sore, is it?
No,
All right.
Only below the elbow.
I'm going to pop a needle in one of these veins and we'll get some pain relief in, all right?
Okay.
All right, little scratch coming up, okay?
Yeah.
Ben inserts a cannula into Paul's arm so that painkillers can be administered straight into the blood.
Are you allergic to anything at all?
No.
Have you had any paracetamol at all?
No.
Okay. It's paracetamol.
Lovely. Thank you.
Got that going.
Although it's just paracetamol, it works really well, actually, through the vein.
Yeah.
It should be a bit quicker for you.
Out of 10, how bad would you say the pain is? 10 being really bad.
Oh, no.
Pardon?
A red 7.
Although Paul's putting a brave face on it, he's still in agony.
Ever had morphine before?
No.
No.
Morphine sulfate, 10 milligrams 1 ml, 223.
Is that easing off a little bit there?
Yeah. No, it's only when I pass it up I'll get the pain.
Okay.
Finally, the pain is beginning to subside.
We're just waiting on the ambulance now, all right?
Yeah.
Paul will be taken to the nearest hospital where he'll be x-rayed to find out exactly what damage he's done.
Hiya.
I don't think he's going to be able to move too far, so I think if we bring the stretcher light right up next to him, stop there a sec, I think come back a bit, that's it.
Are you all right there?
Yeah, perfect.
As they are confident his injury doesn't involve the spinal cord, Ben and Mitch help Paul to get himself onto the stretcher.
Brilliant work. Well done, Paul. So your head goes that end,
Going up this way, yeah.
and then we'll bring your
Hold
feet
your
up.
back if you've got the legs.
Okay. Keep your feet together, keep your feet together, that's it.
Will he have to stay in?
We don't know. It's completely up to the doctors and what they see and what they find.
He was clearly in a lot of pain and he may have some rib fractures. Hopefully he hasn't done anything to his lung or anything like underneath.
Ambulance service, is the patient breathing?
He is breathing, yeah. I'm not
Okay, bear with me. Is he awake?
I don't know. He looks unconscious to me, but he's
What
breathing.
happened?
A car hit him. He's a chap on a bike.
Is he able to speak at all?
No.
No. Are you next? He's unconscious.
Yeah.
Every year, more than 4,000 cyclists are seriously injured on Britain's roads. Many suffer life-changing injuries. Will and Dr. Mark are dispatched.
So 3, Litchfield Hospital at 1421, heading towards Sheffield with an ETA at 1424, head over.
003, that's received. Go to car versus push bike, 30-35 miles per hour.
An ambulance crew is treating the patient, but is asking for further assistance.
Patient has some pelvic pain, neck and back pain, and could consider he's got a respiratory rate of between 30 and 36. No obvious chest injury on their examination.
The accident's taken place near a junction on a main road.
They can't see any houses, no wires crossing that field.
The Helimed crew quickly identify a nearby field where they can land.
Landing.
All right. Hi, all right, hello. Hello, sir, all right.
Hiya.
What's your name?
Ian.
Ian, my name's Will.
38-year-old IT analyst Ian was crossing a junction when a car turned right suddenly, crashing into him. The ambulance crew found Ian lying in the road, unable to get up.
Main injury for us is the neck.
Dr. Mark receives an update on his condition.
Sharp, very tender pain to lower neck, upper back. That's why I called you in.
Okay.
He has had 1 gram IV paracetamol.
Yep. Breathing-wise?
Breathing-wise, respiratory rate has calmed down. When we first got here, it was about 38. Right. As you see now, breathing about 20,
okay.
28.
Dr. Mark and Will have been called because there's a risk Ian's broken his neck, a serious injury that can lead to paralysis or even death.
Try not to move your head. I think you're doing quite well there, aren't you? How's that collar feeling on you at the moment?
It's a bit uncomfortable.
The ambulance crew have fitted a cervical collar to stop Ian moving his neck and potentially causing more damage to his spine.
So where are you hurting?
Top of my head, sort of top of my back, underneath, you know, like sort of at the bottom of your neck, top of your back.
Yeah, yeah.
That was...
And is that quite central, or is it onto one side at all?
Kind of slightly to the left.
Of your spine?
Yeah.
Okay,
yeah.
All right then.
Like that really hurt when they started touching it.
Okay.
While Will assesses the patient,
it's a pretty impressive impact.
Dr. Mark examines the car. The extent of the damage may provide clues as to which part of Ian's body took the full force of the impact.
Did you see the video, Doctor? We took the dash cam out and put it into laptop.
The police have retrieved footage from the driver's dash cam, a valuable tool to help Mark assess the seriousness of Ian's injuries.
You should see the cyclist just coming down there.
Okay.
By reviewing the footage, it appears Ian's neck and upper back collided with the car, but Dr. Mark and Will also need to look for internal injuries that may not be obvious.
All right, can you take a deep breath in for us? Okay, and back out. Lovely stuff. Any pain when you breathe in?
Sort of the, I kind of like the middle of my back.
Is there anything on the outside of your hips, that pain-wise, that you're feeling?
That seems okay.
I'm just going to run my hands sort of down your thigh here. Is that all right? Yeah. Any pains there?
Not quite.
No. And then if I do exactly the same on this side, okay?
Yeah, it's not excruciating pain, but it does hurt.
Right, on top, okay.
Will wants to be sure Ian hasn't fractured his pelvis, a common injury in high-impact collisions that can cause severe internal bleeding and is extremely dangerous.
Do we think that you're able to bring these legs together? Is that manageable for you?
I can't move the left one. I can't move the left leg.
And is that because of the pain?
It's almost like there, my leg's like super heavy.
Don't force it, don't force it. I'll just give you a little bit of a hand. So you're helping me there, aren't you?
Yeah, a little bit, yeah.
Lovely.
It's definitely easier with you doing that.
Yeah, cool. Okay, mate. And we'll just bring this right one back in. Okay. It's not pelvic. It doesn't look like pelvic. It doesn't sound like pelvic. I think low suspicion for pelvic injury, given how he's presenting and everything he's got. Nothing neurological. So the worst of his injuries, I think, is the sort of back pain. It says it's lateral. It's not really central. And then he's complaining of sort of thigh, more groin thigh.
I guess he's come onto that windscreen with his chest and upper body and heel quite, hasn't he?
Yeah.
Yeah. We'll help get onto a scoop and then go from there.
Yeah. Will and Mark need to move Ian slowly and carefully onto a stretcher and into the back of the ambulance.
So what we're going to do, sir, is just roll you ever so gently towards me on this side, and then we're going to put a little plastic scoop under you there, OK?
It's going to be 1, 2, 3, roll, all right?
Yeah.
1, 2, 3, roll.
Lovely. OK, and back. OK.
The same again.
Yep.
1, 2, 3.
Oh!
Where was that?
That was like...
And back.
And that
top of my back.
Okay.
And what we do now is we fasten your head down, all right?
Okay.
Two at the top, two at the bottom. On lift. Ready, set, lift. Okay. Okay, feeling a bit warmer now, Ian?
Yeah, feeling a bit better now.
Okay, cool. Good job you're wearing a helmet, right?
Oh, yeah.
Ian, I think at the moment, I think our plan is to send you up to Shrewsbury, okay, because that's the trauma unit for this area.
Okay.
And you get scanned there, and you get your wounds treated, and then they can diagnose you from there. All right. Okay. The main thing is you're awake, you're moving all your arms and legs, okay. And your all numbers are good. There's no huge concerns from us at the moment, but we've always had a very big impact, and we need to get you scanned. All right.
Yeah.
Given the nature of Ian's injuries, Mark and Will decide to leave him with the ambulance crew, allowing them to be ready for the next emergency call.